femoral triangle is a triangular depression on the anterior 1/3 of thigh. Base of the triangle is formed by the inguinal ligament, which is attached laterally to the anterior superior iliac spine and medially to the pubic tubercle. It is bounded medially by the medial border of the adductor longus and laterally by the medial border of the sartorius, and its apex is formed at a point where the medial and lateral boundaries cross each other. The floor of the femoral triangle is formed medially by the adductor longus and pectineus muscle, whereas laterally it is formed by the iliacus and psoas major muscles. Discussing the boundaries of femoral triangle, now let's discuss the contents of femoral triangle. The contents of femoral triangle can be divided into three sections: vessels, nerves, and lymph nodes. Most lateral content of the femoral triangle is the lateral cutaneous nerve of thigh. It crosses the lateral angle of the femoral triangle and then it divides into its anterior and posterior divisions. Medial to the lateral cutaneous nerve of thigh is a femoral nerve. Femoral nerve is the chief nerve of the anterior compartment of thigh. It enters the femoral triangle behind the inguinal ligament and lies in the groove between the iliacus and psoas major muscles and divides into its anterior and posterior division. The saphenous nerve is the branch of the posterior division of femoral nerve that approaches the apex of femoral triangle. Nerve to pectineus arises from the femoral nerve just above the inguinal ligament. It passes behind the femoral sheath to reach the anterior surface of pectineus. Let's discuss the vascular content of the femoral triangle. Most lateral vascular content of the femoral triangle is the femoral artery. It arises behind the inguinal ligament and enters the femoral triangle and divides into the three superficial and three deep branches. Three superficial branches include the superficial circumflex iliac artery, superficial epigastric artery, and superficial external pudendal artery. Three deep branches are the profunda femoris artery, the deep external pudendal artery, and several muscular branches. The lateral circumflex femoral artery is a branch of the profunda femoris artery that passes between the two divisions of the femoral nerve. Femoral vein accompanies the femoral artery. It is medial to the artery at the base of the triangle, whereas it becomes posteromedial to the artery at the apex. Femoral vein receives the great saphenous vein, which then receives the tributaries corresponding to the branches of the femoral artery. After discussing the vessels and nerves, the content that is left behind are the deep inguinal lymph nodes that are present just medial to the upper part of the femoral vein. From lateral to medial side, we have the contents as femoral nerve, femoral artery, femoral vein, and lymph nodes. The femoral sheath is a funnel-shaped fascia that covers the upper 3 to 4 cm of the femoral vessels, whereas the femoral nerve lies outside the femoral sheath. The femoral sheath is asymmetrical. Its lateral wall is vertical, whereas its medial wall is oblique and is directed downwards and laterally. The femoral sheath is formed by the downward extension of the two fascia of the abdomen. Its anterior wall is formed by the extension of the fascia transversalis, whereas its posterior wall is formed by the extension of fascia iliaca, which covers the iliacus muscle. It is divided into three compartments by septa. The lateral or arterial compartment contains the femoral artery and the femoral branch of genitofemoral nerve. The intermediate or venous compartment contains the femoral vein. Most medial compartment is the smallest of all and is called the femoral canal, which is described here. Femoral canal is conical in shape, being wide at the base and narrow at the apex. It is about 1.5 cm wide at the base and 1.5 cm long. The base or upper end of the femoral canal is called femoral ring, and its boundaries are important. It is bounded anteriorly by the inguinal ligament, posteriorly by pectineus, medially by lacunar ligament, and laterally by the septum separating it from the venous compartment. The femoral canal contains the lymph node of Cloquet or Rosen-Miller, a small amount of areolar tissue and lymphatics that drain the lymph from the clitoris in females and penis in males. Let's discuss how saphenous opening is related to the femoral sheath. The saphenous opening is an oval opening in the fascia lata. The center of this opening is 4 cm below and 4 cm lateral to the pubic tubercle. It is about 2.5 cm long and 2 cm broad, with its long axis directed downwards and laterally. The saphenous opening has a sharp crescentic lateral margin which lies in front of the femoral sheath and ill-defined medial margin which is formed by the fascia covering the pectineus. The saphenous opening is closed by a modified type of superficial fascia called the cribriform fascia. This was all about the femoral triangle. Hope you get a little idea from this video. If you like this video, don't forget to subscribe.